resources of hope. So I'm going to talk about 6 campaigns and struggles which have, I would argue, contributed to the possibilities of changing the landscape and challenging this crisis in mental health. So I want to talk about those 6 resources, but first, what are the 4 aspects of this crisis in mental health? Well, the first, I'd argue, Sue has already mentioned, the cuts in mental health. So we've seen 1,700 beds cut over the last 2 years. That's nearly 10% of the total. And I think we'd argue, although often inpatient care isn't ideal and what we want it to be, when the alternative to that is people ending up in prison or people dying because of lack of support, then we absolutely need to challenge those cuts, I'd argue. So we need to challenge those cuts to inpatient provision. We've seen 3,640 nurses, fewer nurses over the last 2 years, and 213 fewer psychiatrists as a result of research that the Health Service Journal has recently done. So massive cuts to both provision and the practitioners available to support people around mental distress. But what the government's saying is, well, that's okay because actually we're increasing community support. But the figures show the opposite of that as well. I think everyone here would know already that there's no real support for that. But we've seen 1 in 3 councils reduce mental health support in the community by 50%. We've seen 68,000 fewer people supported, mental health service users supported through adult social care services over the last 10 years. So serious cuts both in inpatient provision and community provision. So that's the first thing. The second thing I'd argue, the second aspect of the crisis is privatisation. I don't know if anyone saw in the paper today that Lockheed Martin, the world's biggest arms firm, is bidding for a $1 billion NHS contract. So this is what privatisation means in the NHS. It means the arms dealers coming in to run our NHS. That's a shocking fact. We've also seen an estimate of £9 billion worth of NHS contracts are estimated to go out to the private sector this year. So massive privatisation of the NHS, whatever Cameron claims. But also I think we're seeing in Liverpool, where I'm based, so I work and campaign in Liverpool, we've seen privatisation and outsourcing used as a way of cutting budgets. So there's a relationship between privatisation and cuts. So the council in Liverpool have sought to cut £1 million from mental health community support through outsourcing of those services. So we see the relationship between the two of those. It's important. The third aspect of this crisis is welfare reform. We're seeing, someone described it as a tsunami of fear that's being created for mental health service users and other welfare claimants because of things like the work capability assessment and the bedroom tax. And the fourth is that those first 3 are increasing inequality, I'd argue. And what we know from the research done by Wilkinson and Pickett at Spirit level is the higher the levels of inequality in society, the greater the effects on increasing levels of mental distress. So we're seeing policies that create greater inequality, and those policies, that greater inequality is increasing the levels of mental distress in society. So just at the time when we need more mental support for people experiencing that distress, we're seeing cuts to what's available to people and outsourcing. So that's I'd argue, the nature of the crisis. We need to reject, though, I think, that some people are saying, we've seen 2 victories for UKIP, and I think we have to reject people turning to the fearmongers, if you like, the dividers, people who want to divide us from each other. We need to reject that, absolutely, and we need to find resources of hope instead. So I'm going to name, briefly as I can, 6 of those. So we need to reject division, that people like UKIP turning ordinary people against each other, scapegoating asylum seekers and migrants and so on. We need to totally reject that. We need to come together and build alliances of resistance. And there have been, I'd argue, 6 really important examples of that we need to hold on to as we build our campaigns here in the North. The first of those, I'd argue, is the brilliant campaigning done by Disabled People Against Cuts, which forced out ATOS, the hated private sector firm that was implementing the work capability assessment. So brilliant campaign. They pulled out early from the contract, and that's because of the resistance of disabled people and their allies. So that's brilliant. So that's resource of hope number 1. The second resource of hope is the fantastic occupation by mental health service users of the Life Work service, an NHS service in Cambridge, which the local trust threatened to close. What predominantly female service users did, with support of local trade unionists and activists, is they went in and occupied the building for 4 months earlier this year, and as a result of that occupation, the Mental Health Trust backed down, they won, and that service is going to remain open for at least 5 more years. That's a brilliant victory, so we need to celebrate that. We need to spread the word, and we invited some of the service user activists who led that occupation to come and speak at our public meeting in Liverpool around cuts in Liverpool. So I think we need to spread the word about these things. The third is, I'd argue, our own campaign in Liverpool. So we had a threat of £1 million cuts by outsourcing closure of mental health resource centres in Liverpool. We had a campaign that was led by mental health service users, but with allies from ourselves in SWAN, local trade unionists in Unison, Unite and other trade unions and so on, anti-cuts campaigners who came together, lobbied, petitioned the council. We started our campaign when we got a leak about the proposals before they'd even published the consultation on it. As a result of it, and one of the councillors at a meeting said exactly this, that our campaign had led them to take the closure of those mental health resource centres, 2 mental health resource centres in Liverpool, take closure of that off the agenda. So we forced them to keep those centres open. So that's a third really important resource of hope. So that's in the last couple of months that we got that news through. And the fourth is, I won't say much about this, but I think the brilliant campaign that Steve and others were involved in, the USUP campaign in Salford against cuts to provision and closure of drop-in centres as well, is another brilliant victory. I know Steve's going to talk about that. I think also these are often user-led campaigns, but with support of trade unionists and activists. But I think we're also seeing trade unionists take a lead in some places. We saw a brilliant walkout by Glasgow social workers at the end of last year against working in mental health and homelessness services against massively high caseloads. What those workers did, they walked out, and as a result of that, the management backed down and addressed the issue of excessive workloads. So that's really important. And the sixth and final resource of hope that I think we should all be talking about as well is the brilliant, I used to work many, many years ago when I was living in London for an organisation called St Mungo's that supports people, homeless people and people with mental health needs. And I'm still in touch with a lot of colleagues that I worked with back in the day, and they fought an absolutely brilliant campaign. I saw them at the TUC demonstration. They've been out on strike for 7 days. And this is a brilliant example of solidarity, because what they were striking over was not a direct threat to their own, although there was an attack on the trade union within them, not a direct threat to many of their terms and conditions, but was about the fact that new starter workers coming in were going to be employed on a much lower rate of pay. So that action was taken in solidarity with those newer workers, that those workers fought. They went out on strike for 7 days. They were about to go out on strike again for another 10 days. The management backed down and they won their demand. So another brilliant victory. So I think, these are 6 really fantastic resources of hope that we need to draw on, that can inspire us in our own campaigning, to help us build alliances between users, workers, trade unionists and anti-cuts campaigners, to push back this austerity and privatisation agenda and put people's mental health needs and support and wider needs before austerity and profit.